Hi, I am Dr. Lynn-Marie Lovell, and welcome to the Accident and Emergency Department, or AED. This is a busy place with people of different ages and an incredible mix of injuries and illnesses. But I'm sure there's one question everyone here is probably asking themselves. Why am I waiting? Great question. The Accident and Emergency Department is actually interconnected with a much larger web of people and services around the hospital. From the highly skilled AED nurses and specially trained emergency physicians to the on-call doctors from various specialties such as internal medicine and surgery, plus a network of testing services such as laboratory and imaging studies. All these moving parts work in your favor if your problem is complicated or urgent. But it also means there are a lot of places where care may take more time, such as a lineup for an X-ray. And this can lead to waiting. Emergency departments are carefully staffed with more doctors and nurses when we know there will be more patients. But like at a busy restaurant, when it's full, the waiting will be longer. The second concept, and this is key, is that unlike local walk-in restaurants, the emergency department is not a first-come, first-served place. We have to decide who gets medical attention most urgently, and we do this using a process called triage, which means to sort. Our triage nurses are specially trained to pick up on clues that might make your condition more time-sensitive. Maybe the person being rushed in before you doesn't look as bad as that guy with a large cut on his head, but if delayed, their condition could be life-threatening. Despite being triaged, your condition might change, and if it does, don't hesitate to talk to the AED staff as soon as possible. Once triage has been done, research shows that there are other big areas that reduce waiting and improve the health of people in the AED. We call these the 4 basic rules of AED engagement. The first is that usually every patient can have one additional family member or friend with them in an examination room. However, since COVID-19, our visitation limits require us to reduce the number of persons in the AED to comply with COVID-19 protocols. This means that only minors, patients who are in labor, elderly and need assistance, terminally ill, and those in the custody of police or prison officers may be allowed to have a family member, friend, parent or guardian, or a custodian stay with them. The second rule of engagement is to keep your cell phone on vibrate or silent and your camera in your purse or your pocket. This is because of patient privacy rights. The examination room is not a place for taking selfies or videos. Rule number 3, the AED is a major area for communicable diseases. So by keeping it clean and sanitizing the germs off your hand, you help protect all of us. Rule of engagement number 4 is about making the accident and emergency department safe not only for all patients, but also the staff. To this end, we have zero tolerance for swearing or aggressive behavior. It may be hard to keep your cool when you're in pain or worried about a loved one, but it's better for all of us if you try. The part of the AED experience that doesn't get the attention it deserves is that after you have seen the doctor, now you may think, well, I've seen the doctor and this is the end of the visit. But for us to make an informed decision on your condition, we may need the results of your laboratory or radiology tests, or to review how you responded to the medication provided. We may also require you to be seen by one of the on-call specialists from another department. At the end of your AED assessment, you may be discharged home with instructions for follow-up or outpatient appointments, or admitted to hospital as an inpatient. In many instances, admitted patients may remain in the AED due to the unavailability of bed spaces. I know this may be confusing. I'm in the AED, but admitted? Yes, you are still physically in the emergency room, but the doctors from your admitted specialty will continue to care for you with the assistance of our AED nurses. Once the bed becomes available, you will be transported to your assigned ward and your care will continue there. When it comes to discharge, research shows that the quality of the discharge, that is, how the AED staff provide their final information and answer your final questions, is critical to a successful AED visit. Take a moment and ask yourself, do I understand the instructions? Do I know my next steps? Maybe my next steps are monitoring for certain signs, red flags to watch out for, getting a prescription, or making an appointment for outpatient clinic. Your next step may even involve returning to the AED for a review visit. Written instructions are better and easier to remember, so feel free to take notes or ask for a summary to be written down for you. Lastly, when coming to the AED, please remember to bring the medications you're currently taking, your family doctor's name and address, and to ensure that we have the correct address and contact number for you and your next of kin. I hope that you now have a better understanding of how the AED works. And even though you may have to wait, know that we are doing our absolute best to ensure that you and your loved ones get the best care possible. Thank you for watching, and we apologize for the wait.